Hello, friends. We are back again. Last time I couldn't complete my presentation, so I thought that I will redo it again today. Very important aspect which I thought we would be discussing, which is the ovarian stimulation during IVF. So I was talking about that when a patient comes and we decide that yes, IVF is required for a particular couple, and that is the time what we do is that number one, we work up the female partner and we completely work up the male partner too. Now, in the workup of the female partner, there would be a battery of blood tests. There would be a special blood test called anti-Mullerian hormone. And sometimes we do a special blood test called follicle stimulating hormone to know what is the ovarian reserve like. Besides that, there would be an infectious screening, the test. For the male partner, there would be semen analysis and also there would be a battery of blood tests just to know the fitness for IVF. Now, once the couple has been found fit to go through IVF, now during the COVID time, we are of course asking even a COVID testing because right now we are offering IVF to patients who are tested negative for COVID. Otherwise, in the initial times, of course, this test was not being done. So once they're found to be ready, then what happens is that IVF can start in two ways. One is the standard protocol, which nowadays what we would be doing, that generally the female partner, they don't need any pre-medication. Pre-medications are only given in the form of a folic acid, which we normally ask the female partner to start about a month before starting IVF or generally along with the start of IVF or folic acid is started. There are very few or limited indications where a female partner is given some additives or some priming agents to make her ovarian response better, but by and large I would say about 90% of patients don't need any medication just because they are entering IVF cycle. So the couple would be typically called on the second or the third day of the menstrual cycle of the female partner, and they normally report to the IVF lab or to the clinic. And what do you expect? So, of course, beforehand, you have visited the clinic and you have already gone through all the financial details, all the consent forms, what is the procedure of IVF. You have understood the procedure. You've had an opportunity to discuss, all the questions which are in your mind. And then your card would be made and also special consent forms during COVID time, of course, which you would be signing as a couple. And then you would also be informed about procedures like ICSI, procedures like embryo cryopreservation. So once all that has been done, then on the second or third day of the menstrual cycle, the female partner would be going through a certain blood test. Now, they are normally three or four in number, and also an ultrasound. Now, this roughly takes about an hour to be performed. And then a working woman can go back to her office to work. And then these reports are generally available after a couple of hours, so they can come back to collect these reports. Now, what do we check looking at these reports? So we look at the fitness to start IVF in terms of your hormonal milieu and in terms of your uterine milieu. Once we have checked that everything is fine, then depending upon your age, depending upon the reason for which an IVF is being done, depending upon if you have already gone through previous IVFs and what kind of response you had, we decide a particular amount of drug and which is called the dose, and these drugs are called gonadotropins. So we would be deciding on that, and then that drug would be started, injections would be started from the second, third day of the menstrual cycle. So generally, the first injection is taught to the patient. They are very simple injections. How normally diabetics take insulin, the same way these drugs are taken. Mostly on the tummy, they can be taken on the thigh, they can be taken on the hand, they can be taken in the buttocks. But most common site is the tummy because that is the least painful area in the body, and that is the place where a self administration can happen. Now, many a times, patients are very scared or skeptical that can they take these injections themselves. Yes, you can very well take these injections very easily yourself. The staff or the doctor will teach you the first set of injection, and then you will have the confidence to administer it yourself. And these injections need to be stored simply in your refrigerator, not in the freezer, but in the refrigerator. If you are carrying an ice pack, then we suggest that put the ice pack back in the freezer, but you keep the injections in the arm of the fridge, and then roughly you are asked to take the injections roughly at the same time. Then the next visit happens is usually after 5 days of the start of the first injection, and then it is the same process that an ultrasound is performed along with certain hormonal blood tests, and now this ultrasound will determine that what kind of an ovarian response are you showing. So if the ovarian response is adequate, so we would typically see about 6 or 7 or even more follicles coming up. But then there are certain patients who show very low response because their ovaries are not very robust or not very strong, which is all right because that is the ovarian reserve what you have, and not every woman will show the same kind of response every time. In fact, even when a single woman is going through two IVF cycles, in their two IVF cycles, they can really show a different response. So once that is checked, then the second set of injection is started. And this second set of injection is started because we don't now want you to ovulate. So we don't want the eggs to be ruptured on their own. Now these eggs need to be collected at some point of time. So the next step is that again certain same injections are continued and a second set of injection is started, and then you are called after about 2 to 3 days after the second visit. Now, in the third visit, also the same drill happens wherein you are asked to go through an ultrasound, which is again a transvaginal ultrasound. And some people can't go through transvaginal, then in that case, transabdominal is done. However, it is normally an internal ultrasound and blood test. Now, on an average, a woman is ready in about 8 or 10 days of injection, and in that much of injection, we determine that you're on ultrasound and by your hormonal test, you are ready. So once you are ready by these tests, then you will be going for a pre-anesthesia checkup and you would also be given a final injection. Now, this injection is very important because that you would be taking about 36 hours before your egg collection. So typically, suppose if we ask you to take an injection at around 9 at night, suppose on a Monday, then your egg collection is expected to happen around 9 a.m. in the morning on Wednesday. So this is how you would be going about it. And so after the anesthesia checkup, then when the final injection is given, the next day there is no injection, and the next to next day you are asked to come in the lab about 1 hour before your procedure, and that time you would be coming empty stomach. That means we need about 6 to 8 hours of complete fasting. The only special medicines which you're allowed to take are like medications for thyroid or for blood pressure. But if you're diabetic, you will not be taking your that day dose of anti-diabetic medication. But yes, thyroid medication or blood pressure medication or any other medication which you're supposed to take, in which, of course, the anesthetist will tell you take it with a sip of water. Please come to the hospital for your egg collection on time and reach 1 hour before, because it takes a bit of a time to have your admission process, changing into the OT clothes and then going for your procedure. And of course, this procedure is doesn't involve any cut on the tummy. It is done through vaginal procedure with ultrasound guidance and under, of course, general anesthesia, but it's an intravenous anesthesia. So you are awake in about 15 minutes, the procedure takes, and you are awake immediately after that. And then you are ready to go back home after about 2 to 3 hours after checking that everything is okay, you're not having any vomitings, and you're able to eat properly. So this is the first way we go ahead with ovarian stimulation in IVF. The second way is a bit longer way, where we actually start suppressing your ovarian hormones roughly about 10 days before the expected period. Now, this was a very commonly performed regime earlier, where most of our patients used to go through this cycle, which is called the long cycle or the down-regulated cycle. But nowadays, since we go more on the shorter cycles, so we have reserved this cycle for certain number of patients where we feel that this cycle will be better for them in terms of egg formation. So yes, nowadays, maybe out of 10, 2 or 3 cycles are on the longer regime. So you are called 10 days before the expected cycle, and then you will be starting a certain set of injections, the preliminary injections. They are not gonadotropins, but they are to suppress your ovaries in such a way that when you report on the second or third day of your menstrual cycle, then that is the time where your ovarian hormones would be suppressed, which we'll again come to know. So the pattern of coming would be the same, but here you would be starting injections about 10 days before. You will not stop the injections before you come to the lab, and you would be continuing these injections even during your ovarian stimulations, which is the gonadotropins, but at a lesser dose. So here again, you would be coming back on day 2, day 3. The same set of hormones would happen, and an ultrasound will happen, followed by a start of gonadotropins, which I just said, depending on your age, your indication, the reason for which you're going through IVF, your previous IVF responses, etc. So then the pattern would be the same. And again, after 5 days, you would be called. Then after 3 days, then you would be coming after, say, 2 days, or maybe you are ready for egg collection. The final injection would, the timing would remain the same. And the time to do an egg collection is also roughly between 35 and a half to 36 and a half hours of the last injection. Very rarely, what we do is a third regime, which is called an ultra long regime, which is reserved for very limited number of patients, wherein we give a certain kind of injection which is given once a month, and that would be given for, say, about 2 or 3 cycles before we start the actual IVF. However, this is not a routine regime for IVF, limited for very few patients, especially for patients of endometriosis. If you have, you would be knowing those patients who have endometriosis, they know this term. And yes, sometimes we advise them to go through this regime. Certain things which you have to remember, that every time you take these injections, you see to it that, suppose if we have given the injection in a pen form, then couple of times the mistakes what happen, that put the needle improperly, so the drug doesn't go out of the needle, and you will see that the plunger is not moving. Then there is a dial up dose. There have been times where patient didn't dial the pen at all, and they thought that the injection has been taken. Normally, there are no air bubbles in these pens, but yes, if you are taking injections from vials, then you have to make sure that the drug doesn't fall off. It's very important. You learn the proper technique, but this technique is very simple, and we always promote that patients learn how to take self injections because they are very easy for a patient to take. You need not be from a medical background. Very small little understanding need to know for the injections, and then it becomes easier for you, because then you can self administer. You don't need a nurse, you don't need to go to a nursing home, you don't need to go to a hospital to take these injections. uh, I think more or less I have briefed you what an ovarian stimulation in IVF is about. Very few additives, yes, we give sometimes to prime the ovaries, especially in cases where they have a poor ovarian response. Uh, we know that, suppose there is an elderly woman or patient who's of matured age, we know that her ovarian reserve is low, or she has shown less response in the previous cycle of IVF or some other stimulation, then yes, sometimes we do give additives which could be for 1 or 2 months, but those are also in very selected group of patients. Now, for the male partner during ovarian stimulation, we do ask the couple that do not have longer gaps from sexual abstinence, because that produces more of dead sperms. So please keep leading your normal life. Then, in terms of activity, there is no restriction. In terms of food habits, there is no restriction. Uh, Bed rest after IVF is a misconception and we do not promote it. Rather, we ask the patient to join back to work, and we do ask the patients to, go back on their normal routine. They can climb staircase very easily because this is very commonly asked. There are no do's and don'ts for the food. So I think more or less I have covered the basics of ovarian stimulation, and now I will be more than happy to answer any questions if you have. So Ashima is asking that how can I stimulate your ovaries? Naturally, you cannot. You will have to be under control of medical supervision. And I just explained that the ovarian stimulation for IVF is not with oral medicines, but it is with the help of injections, which are called gonadotropins, and which are available in very easy drug delivery system, which I just explained that they can be easily self-administered once you have learned the first injection. You need not visit the center on a daily basis. Pallavi is asking that why blood test is required. Yes, it's a good question because sometimes it becomes very difficult to, interpret only an ultrasound. And then there are situations where on ultrasound it is showing that the follicles are growing well, but the hormone levels are very low. So we know that the competence of the ovaries is on the lower side. And sometimes there are situations where, despite giving injections, your ovaries are taking a long time to get stimulated. So the hormonal levels help us, in deciding that do we need to change the injection, do we need to change the dose, or do we need to increase something or add something. Mr. Rahul is asking what are the factors that affect ovarian stimulation? Yes, very good question. There are many factors, but the most important factor is the age of the female partner. So, any age more than 37 years is yes, the ovarian reserve is low, and that is why we do check for ovarian reserve before an IVF cycle. Secondly, is that if there is any ovarian surgery which has been done in the past, heavy smokers, they could have low ovarian reserve. Any previous pelvic infections, again, we have seen that patients can have low ovarian reserve. Previous IVF stimulations, where we see that there are low ovarian responses, of course, are another factors which can affect ovarian stimulation. Then also patients who have gone through cancer therapy, that majorly affects the ovarian stimulation and response, and that is why nowadays we are promoting even fertility preservation for younger unmarried girls, they have any precancerous or cancerous situation, and if they are going through any cancer therapy, that please come forward for your egg freezing, because by the time you will be looking at fertility it will be too late. So, side effects of these injections, if they are given properly and monitored in a safer way, then these injections will cause ovarian response but will not cause ovarian hyperstimulation. But yes, there is a known complication of ovarian hyperstimulation due to these drugs, which can be controlled, and that is why different regimes are used. Very rare complications can be during egg collection, some bleeding or some infection, but that rarely happens. So the only complication due to injection, except for any injection site, infection or abscess, is basically ovarian hyperstimulation, which we know how to control because that is the reason we perform ultrasound as well as the blood test. Thank you, Kushbu, for asking this question. It was very important. Mr. Rajkumar is asking what do cysts do? Okay, so so that is why ultrasounds are performed on second or third day of the cycle, because sometimes ovaries can have cysts, but normally with medium sized cysts they don't affect the results of IVF, and we don't really try removing them or giving medications, because in IVF the ovaries can very well form eggs around these cysts. But yes, sometimes these cysts are like a bag which could be containing some fluid, some material, old blood. So in endometriosis patients, very commonly cysts are found. But if the cysts are very big, say about 7 centimeters or 8 centimeters, and they are not temporary, then yes, for sometimes even for patients undergoing IVF, we do ask them to go through surgery. So we do a good laparoscopic surgery, and followed by we can decide whether they need IVF or not. Richa is asking that how menstruation affects the ovarian stimulation. Also, Richa, we are not giving any pre-medications. So normally your menstrual cycle is expected the same time how you would expect otherwise. Yes, after an IVF cycle, after the egg collection, suppose if we have not done an embryo transfer because we have frozen your embryos, then patients are expected to have the first cycle early because the moment hormones withdraw, you will get your first cycle early. However, the next cycle would be at the same pattern, the way you have been getting it. So Mr. Surinder is asking that why drug is needed. Yes, it's a very good question and very commonly asked to me. See, in a natural conception, you only need one egg and one follicle. But human reproduction is not so robust. It's not 100%. So in IVF, naturally, when you are, trying to fertilize these eggs outside, I always explain it to my patient that number one, you need more than one egg. Rather, you need about maybe 8 to 15 eggs, which is good for an IVF cycle because not all eggs are mature. If not all mature eggs fertilize, and not all embryos progress to an advanced embryo, and that is why you may start with, say, 10 eggs to start with, but maybe 7 or 8 could be mature, maybe 6 fertilize, and maybe in the end you have good 2 or 3 embryos. And that is why, because every embryo gives about 50% chance of pregnancy, but that is also dependent upon the age of the female partner, and that is why we need these injections so that we can little bit super ovulate the ovaries, and we can have more number of eggs so that you can have a better chance of pregnancy. Also, we use a word which is called cumulative live birth. Cumulative means nowadays it is not one IVF cycle, and it is one IVF cycle with the number of embryo transfers. So if you have embryos available for say 2 or 3 times, then you will have a better chance of pregnancy because you have more embryos available for more number of transfers. Swati is asking how to maintain diet and lifestyle. Yes, absolutely. You have to maintain normal diet. Rather, I ask people to take good quality protein, simple food. Home cooked food is good enough with certain nuts, good nutrients. Have an active lifestyle. Refrain from smoking and alcohol. Or drug use during stimulation and even before that, because that's not only detrimental for stimulation but also affects the oocyte quality. So if you are doing an exercise, please continue doing it. Except for that, during ovarian stimulation, sometimes I do ask the couples, female, to avoid too many abdominal crunches or jumping exercises because these stimulated ovaries can have a tendency to twist, but you can absolutely continue your treadmill, cycling, walking, or normal yoga, what you're doing, or swimming. You can continue that. Thank you very much, and I hope you found this informative. I will come back again next week. Thank you.